A federal judge in San Francisco has decided in favor of those trying to get fluoride out of the water that the EPA must review the risks of fluoride in drinking water to children. Now, of course, NBC right under that says that the federal judge in San Francisco stressed he wasn't concluding with certainty that fluoridated water endangers public health. But if you read the article, it's pretty clear that this U.S. District Judge Edward Chen said that current practice of adding fluoride to drinking water supplies to fight cavities presented unreasonable risks for children's developing brains. Quote, the scientific literature in the record provides a high level of certainty that a hazard is present. Fluoride is associated with reduced IQ, wrote Chen, an appointee of Democratic former President Barack Obama. So you can't blame this one on Trump. What I think is so interesting is this came out a few days ago. This is an article by NBC in 2018. Science says fluoride in water is good for kids. So why are these towns banning it? And the first couple sentences, it's been hailed by the Centers for Disease Control and Prevention as one of the top public health achievements of the 20th century. Numerous studies have proven its safety and efficacy, but fluoride, the naturally occurring compound that prevents cavities and tooth decay, is still sparking heated debates 7 decades after it was first added to America's water supply, and then calls people anti-fluoridationists, a small but vocal minority, disputing long-established science that say fluoride added to tap water lowers IQ and causes everything from acne to anemia to Alzheimer's. So just 6 years ago, writing that anyone who questions this is an anti-science, anti-fluoridationist, whatever they want to call it. And now fast forward to 2024, we have an article about a judge in San Francisco saying the EPA, and this is exactly what they have to do, essentially has to come up with a regulatory response. The EPA does under the Toxic Substances Control Act. So it's just really interesting to see how the news changes over the course of 6 years. And if we were to just listen to NBC, as if the science was totally settled on this, we would have totally conceived of these people as complete nut jobs. And now look at the difference in reporting. So Dad, Dr. Chip Abrahamsen here, also my dad, does a lot of healthy living tips and stuff, has been talking about fluoride for a long time. drchipabrahamsen.locals.com for more on that. I guess your first thought on this decision, because I have not heard a whole lot. I know these lawsuits have been going through court, but this seems like a new movement, maybe in the direction of the people who have been suing to get fluoride out of water.
Yeah, this is a okay. I'll call it a response. I was going to say a reaction by a federal judge or a judge in San Francisco, and on to the EPA, and basically what they're saying here is we need to have a safe limit of fluoride. They're not saying fluoride's bad and you need to get rid of it. They say the EPA needs to say that a certain amount of fluoride is safe, and it will still prevent cavities or whatever. So this is more, okay, we're getting pushed back. Let's maybe we'll just lower the amount of fluoride that we sell from Alcoa and Florida phosphate mining and plutonium mining and toxic waste that we used to have to get rid of for millions of dollars that now we can sell with the American Dental Association in our pocket and even put it in toothpaste. Everybody's seeing that it's bad for them. So, okay, we'll just lower the limits and we'll make it look official by getting the EPA to set a limit on what part per million or part per billion of fluoride is safe for children. And then 40-some% of people in the United States will go, well, as long as it's 0.04, then it's safe. The EPA says this is no different from what's been going on for 100 years. The big industries are lobbying and paying the government to do things like set limits. But if a poison is a poison, how can you say that a little bit of it is good for you? Okay, maybe there is something like homeopathic medicine, but I don't see how a little bit of fluoride helps anybody.
All right. We're going to go over the claims made by the CDC. I'd like to just, since that's what everybody references, I'd like to just go through their what to know section so we can talk about that and talk about their claims that it helps prevent cavities because it kills bacteria. If you're somebody, however, who's sitting back thinking, I don't want to drink fluoridated water, but that's all I have access to, you can have access to wine instead. So then just put down that fluoridated water, get your AllisonWinePromo.com. You don't have to worry about it. There's no fluoride in the Allison bottles of wine right here. See, I bet you I could even get them to put a label on my wine that says fluoride free. If you go to AllisonWinePromo.com and sign up, you will be in the wine club, which means you'll get 6 bottles of wine every 3 months. These are remote regions of the world, hand-picked grapes in a lot of cases, 6,000 to 9,000 feet, no added artificial dyes, flavorings, fillers, that kind of thing. Many of these operations are still doing natural fermentation and old world winemaking methods that have been passed down from 3, 4, 5 generations of winemakers and their families. Way too small to sell in the United States, frankly, but this company, Bonner Wine, and I've had Diego on the show, who is the guy who goes all over the world looking for the best wine. He goes to these really remote mountain regions, and like that's his job. He risks his life to find the best wine. You might question his sanity, but hey, we can all benefit from it without having to do the same thing. AllisonWinePromo.com. So let's go back to the CDC. Want to just show everybody what their claims are. Fluoride helps both children and adults prevent cavities. And preventing cavities means fewer and smaller cavities and less pain. If you don't get cavities, you lower your chances of needing fillings or having teeth removed. And it says fluoride works by repairing and preventing damage to teeth caused by bacteria in the mouth. Bacteria in the mouth produce acid when a person eats or drinks. The acid dissolves minerals in the tooth surface, making the tooth weaker and opening to cavities. And right. So they're just saying, okay, and maybe they would even say this still, okay, like you said, maybe there's a little bit of risk to it. But look, the reward is so great. We have this real problem of dental health in the United States. And a lot of journalists will say that. I have one friend in particular still really bought in on this, still in the news business. And she and I went back and forth about this. There's counties that don't do fluoride in the water, and the teeth are just terrible there. And so they'll use that as a reason for why we have to keep doing it. Because they'll just say that that's obviously like the A plus B equals C. So what about the claims from the CDC? Does fluoride prevent cavities?
I really like that article. It shows pretty clearly that fluoride is an antiseptic and it kills bacteria. So if you have an infection, fluoride might help you. If you have cavities and you have bad, quote unquote, bad bacteria, streptococcus, whatever it is, the one that causes, it slipped my mind, but it's the one that causes cavities. Anyway, so fluoride might help if you have really bad gut bacteria and really poor dental health. That to me doesn't make it a public health emergency. That just means that if you want to go to somebody and get some fluoride toothpaste and use it, well, it's a free country. But why should my drinking water from my city be fluoridated? My health is fine. I don't need fluoride for my cavities because I get adequate vitamin D from sunshine and cod liver oil. And I just don't get cavities. And my dentist always says, the hygienist says, I don't have anything to do. And the dentist says, you're too easy. There's nothing to do here. We don't need to get any x-rays for several years.
And this is a change for you from before. You used to have really bad teeth.
Oh, yeah. I used to have.
And use fluoride all the time.
Yes, I used to use fluoride a lot. But, think about it. Would you want to take an antibiotic every day when you're healthy? Just in case you might get an infection? Everybody knows that causes resistant organisms now. Hospitals are the worst places to be because they use antiseptics on everything. They use really strong chemicals. Every time a patient leaves the bed, they chemical down the whole room. And within, I believe it's 48 hours of an ICU admission, a person's skin and gut bacteria changed from something like 10% quote unquote bad bacteria to 95% pathogenic bacteria. So the worst place you can be, and people know this, is in a hospital, but especially in ICU where, they're using chemicals on every little thing. So fluoride maybe initially, and those chemicals maybe, initially might be doing some good, but after time, the quote unquote good bacteria, the ones that don't cause disease, are going to be destroyed, or they're going to change their genetic expression and become stronger and more disease causing.
Okay, let's do a brief history for people of fluoride and
Good.
where it came from. And this NBC article from 2018 that I mentioned earlier does say, it goes back many years. What, to the 40s, 50s, 1950s? No, 40s. Somewhere around there, but they're saying the conspiracy theories about fluoride emerged in the 50s. Claims that fluoridation was a communist plot to dumb down Americans. And it is now alarming public health officials, including the American Dental Association and the American Academy of Pediatrics, who say fluoride is safe and an inexpensive way to boost children's oral health. But yeah, the conspiracy theories go back a long time. Let's do a history, please.
Oh, so fluoride goes back probably 100 years or so. Plutonium mining, when they decided to make a nuclear bomb, caused, in the processing, refining, caused fluoride to be taken out as a toxic waste, and they had to deal with that. What are we going to do with it? Aluminum mining, taking bauxite and refining it into aluminum, also releases a tremendous amount of fluoride. And the last one is the fertilizer industry. In Florida, the phosphate mining causes, in its refining to phosphate fertilizer, leaves out fluoride as a toxic waste. So these three big companies historically had to get rid of toxic wastes, kind of like mercury in your dental fillings. When they put mercury amalgams in your teeth, it's considered safe by the FDA. But when you have them taken out, mercury is a toxic substance and it has to be disposed of properly. When the dentist has to pay, when the dentist takes it out, he has to pay for proper disposal, including a negative pressure room, whatever. But when the company that sells the mercury amalgam to the dentist, it's not considered toxic, so they don't have to pay anything or be responsible. Fluoride's the same way. These companies wanted to do something about the fluoride. They probably lobbied pretty hard, starting, I think, with Alcoa, but then with the nuclear industry with them, and then phosphate mining in Florida. They probably lobbied, I'm certain they lobbied the federal government and said, why are you making this a toxic waste? And they probably said, well, it is. And so they went to the American Dental Association and tried using it on cavities, and the ADA bought in, probably because they were lobbied, which means bribed. That's what lobbying is, bribes. And somewhere around 1920, Weston A. Price, a dentist, noticed that all his patients were getting cavities when these same families in his small town weren't getting any cavities for 20, 25 years of his practice. So he purposely went to an American Dental Association meeting in the 20s to say to them, have you guys noticed this, and what are you doing about it? And they said, oh yeah, it's happening to all of our patients too. And what you need is fluoride in your city water. And Weston A. Price, being one of the few good doctors or dentists back then, said, I can't believe that. They didn't have fluoride in their water for 25 years and their teeth were fine. It's got to be something else. And that's what started him on his quest to 6 traditional societies where there were families right on the edge of modern living, and they would send a couple of their kids to work for industry, and their kids would start eating refined flour and sugar. And then they'd have a couple of kids that were still at home, and then dental samples were taken by Weston A. Price, and saliva samples. And he concluded pretty clearly in his book, nutrition and physical degeneration, that fluoride was not the answer, that the problem was refined flour and refined sugar. That's what was causing cavities, and fluoride is, not the solution. And it's a great book. It's a book that I found when I had two really painful teeth for 2 years, and my dentist couldn't figure it out, so he just wanted to do root canals just to take the nerve out, so it wouldn't hurt anymore. And I told him, that's, you're crazy. I'm getting a second opinion, and I Googled it. In 2009, I found Weston A. Price's book, which was written in 1949. I found the cod liver oil that he recommended from David Wetzel in Nebraska, greenpasture.org. And I started taking it. My pain went away. I was chewing oatmeal in 3 weeks, and I was pain-free chewing ice in 6 weeks. I've had no pain since. I had a stress fracture in my dentin from vitamin D deficiency. The last thing I needed was fluoride or a root canal. I needed better health. So
thank you for leading into my next sponsor. If you want the product he's talking about, go to greenpasture.org and use promo code Allison at checkout. Specifically, though, they have a lot of great stuff here. Dr. Chip is talking about this, the fermented cod liver oil and concentrated butter oil blend.
That's the stuff that Weston A. Price recommended.
You can get capsules. We all take the gel. And my favorite flavor, and the kids take it too, is the cinnamon tingle flavor. But they also make a chocolate and an unflavored. So anyway, yeah, can't say enough about this product. It's really great. And both my dad here and I have been taking it for quite a while, and it helped me very similarly. I didn't have to have root canals, but I used to get cavities all the time. And really, same thing. The dentists are always amazed, because I don't go into the dentist that often, but then they never really want to know why my teeth look so good without conventional dental care.
No, my dentist didn't even know why I never got the root canal. Yeah.